Okay, dear students, today I will be telling what are the advantage of becoming a pro member in Dr. Bharath's Pharmacology app. So when I open the app, so when you become a pro member, so this is the one, PG aspirant pro members, the second one will get opened up. And when you open up, there will be different divisions here. We have classified them into topics or question bank, then the national exams, innovative learning, reasoning, and major drug interactions. Now topics or question bank, we have subclassified them into different like general, ANS, autocoids, and in the end we have classified them as miscellaneous topics, newer drugs, disease guidelines, treatment of choice, applied pharmacology. Now what does each topic give to you? When you open general pharmacology, it is subdivided into introduction, pharmacokinetics, dynamics, and PK problems, and also clinical trials. And also nowadays the trending is image based questions, so that is a separate. Pills, that is nothing but pharmacology in lone lines, that is one liners have been given in a separate tab, and mnemonics, newer drug delivery system, and important lists like drugs causing hyperkalemia, hypokalemia, all these things have been added. Now let me take one topic, introduction to clinical pharmacology. So here you will see the time and the number of questions, and you can attempt it multiple times, unlike other apps where you can attempt once and you cannot attempt second time, so you can retake the exam. So this is the tab you will get. You start the exam, then when you start the exam, this is the question and 4 options you can select and go to the next options. You can select whatever answers you know that. Okay, so I'm just randomly clicking, and in the also you have a question list. You can check what are the questions you have answered, and also you can go to the last question and answer and end the exam. So you can end it or pause it for the future this thing, and you will get the number of trophies here, and also at the end you will get the analytics where how many questions are there, how much you have scored, what is the cutoff to get the trophy, and how much you have scored, and at the end you can get solutions. So when you go to the solution section, so you will get the explanation with the proper referencing, and also if you have any comments or any doubts with regarding the questions, you can post this in the comment section. So you have different answers and their explanation given in a brief manner, so you can go through that and you can utilize this app. Now this is the advantage of using the app. You can carry the app wherever you go on, and that is the topics and general pharmacology. And now come to the national exams. So this contain mainly high yielding the recent papers, not the old one. So if I click on AIIMS, you can get the last 3-year papers. NEET, you can get NEET pattern, last 2 years important papers, and jipmer particularly you can get up to 2 years paper. So because these are the papers which you have to concentrate, and you can take the exams, retake the exams. Now innovative learning, what does it contain? So we have made a separate tab for mechanism of action, so you can take up the MCQs here also. Mainly one question definitely will come from the mechanism of action, so that's why we have made it a different tab. And we have made a confusing drugs. Yeah, it may be easier for someone, but for few people who confuse the drugs, we have made a list of drugs which are confusing, and what is the important features we have made in a confusing drugs. And drug specific effects is a separate tab where we have given different hit and run drugs, hyperprolactemia causing drugs, gingival hyperplasia causing drugs. So all things will be at one place. And also we have something called case based learning, where we will post a case and the question related to that will be discussed there. Now after that there is something called reasoning, where you will find why glucagon is used in beta blocker toxicity, why amiodarone is not used in ventricular tachycardia due to digoxin toxicity, why lignocaine is used in ventricular tachycardia with MI. If I open, you will see the reasons why it is not used. Now apart from that, major drug interaction, this is one more topic that will be asked. Nitrate plus phosphodiesterase 5 inhibitors, what is the reason? So all these things are being given in the app. This is for the pro members, and pro members can also use free test series. There are around 6 to 7 test series, and also you can take use of drug classification, the advanced quick revision of drugs. So we have given the drugs, only the brief overview of the drug, not the entire thing. Only you can check up prodrug, what is bambuterol, and what is important for your exam. Not everything has been given here. Along with that, we are given something called drug classification. Mainly the classification is based on mechanism. We are not concentrated on the chemical classification. Mainly it is the mechanism based classification. So if I open drugs for peptic ulcer, so it's the histamine blockers, proton pump, prostaglandin analogs. So like this you can have a quick revision. So if you have this, at least you can answer the drugs, their mechanism of action. That's why this is being added. Now that's all for the app. So mainly you have to purchase the pro membership. You will have so many advantages. You can take this app and it will be a app which you can carry in the pocket. Wherever you get a free time, you can solve the questions, and along with that there are many concepts that are present in the app. So thank you.